Good morning, everyone. This is a David Menzies piece here, and I just wanted to show you he's around the protesters, and these are two other reporters saying, "Man, why you got to be causing trouble?" And then this is an RCMP a Canadian Rail, I think, police officer, and nobody's doing anything. They're threatening Mr. Menzies, but like with arrest, but nobody's doing anything to remove the protesters from the tracks. And there's police that are very, very nearby, right? Link is in the description. You can have a watch if you want to. Here's protesters tied in. Oh, I'm not even going to try it. I was going to try it, and I'm going to not try it. And here they're lighting a fire on railroad tracks. I don't know if there's cops nearby, but it's a dangerous situation, and people were aware of this, aware enough to be reporting it on the news. And this was a regular scene in the early part of 2020.
Being trained, but also could have been very dangerous for many other people, because what if this train was carrying dangerous materials that could have ignited?
So there's lots of protests that happen in Canada, and you're allowed to protest, right? And apparently you're allowed to light a fire under a train as it's trundling on by, right? Rolling down the tracks. Light a fire, don't worry about it, no problem. Here, we're gonna record you guys, right? But don't you dare protest the social distancing. Here's a video out of Edmonton, I believe, and from yesterday, May 10th, 2020. Here you go.
So now I am being charged. So tell me exactly what I'm being charged with.
Charged under section 711 of the Public Health Act.
So person is being detained.
711, what is it?
So why am I being charged when there's a whole other group of people here, and yet you're going to come and pick on me?
We're not here to argue it yet. What is
Do you guys have a problem with the things that I was discussing here today?
711 is? 73 someone. Well, he said 71 so make up your mind. 71 73
I am here peacefully. I'm not doing anything wrong.
It's an act.
I am not in a
It's
group.
not something that we have to follow. It's an act. 71 73 they'll figure it out eventually.
I don't have
No,
ID.
he doesn't have to comply. Then you're going to be under arrest.
You guys took that from me last year.
Is there anything that we can say or do before putting hands on you to get you to come over to just let us give you a provincial ticket, which you can find legislatively in court? So anything that we can do before we have to put our hands on you and drag you over there?
I'm sorry. These are unlawful orders. You are infringing on my unalienable rights, my God-given rights that are endowed upon me by my Creator, and I am not going to comply.
You guys want to grab that? You're going to be under arrest. What is your name? What are your names? What's your badge number, sweetheart? Hey, what is your name? What is your name and badge number? You're already breaking his stuff, people.
Alberta, Canada. This is happening, and you guys.
This is Canada. This is in China.
So I don't know why him. I don't know what was happening before this happened. Here's more video, I think, or maybe it's a Facebook post. I've seen other people saying they had other video, but I haven't seen the other video. I was going to try to find the reference of the health code that the officer was referencing, 73.1 or 71.3. I'd seen it on the Reddit thread, but I didn't save the Reddit thread. I saved this, so I apologize. I don't have the legal reference for you right now, and I don't have the time to run and get it. But fundamentally, I think that we're living in dangerous times when you see clearly that you can start a fire on some railroad tracks and not be infringed upon by the police. However, if you're sitting quietly, not wearing a mask, infringing on a public health order, and these are new bylaws created in haste. Why are 3 cops necessary to deal with this person? To me, I mean, this is a 2-minute video, so I don't know what happened before this. I don't know what he was doing. This was an anti-lockdown protest, but there's a lot of people. Why this guy? Why does this guy get literally dragged away? He said, that's an unlawful order. You're asking to contravene my God-given rights. I will not comply. I think he's right? I think this guy's is quite right, except that we live in Canada, and the charter rewrote the rights as something that is given by government and can be taken by government, which is not quite right. Not right at all. So, man, this is happening. I think the right way for all of these people to have dealt with this is to come and stand between the police and this person here. But then they'd be contravening the social distancing rules, right? Checkmate. How do you deal with this? And we're in a situation where the president of Tanzania sent a papaya fruit and a goat sample that came back positive. We've got healthcare workers who are working in, and I'm going to show you this in just a minute, but healthcare workers who were working in old age homes that didn't want to expose themselves to COVID-19, so they decided to quit the old age home, and then they were refused a test after they got another job in another old age home. So this person pushed and got a test. Guess what the results are, right? It just seems weird. Here's Justin Trudeau, and Justin Trudeau warning everyone. I forgot to do it the last couple of times, and the other shows were kind of contingent on it. But this is an interesting video. This is about 30 seconds, so fast forward 30 seconds if you don't want to hear Justin Trudeau. If you do want to hear Justin Trudeau, this is unprecedented.
Good morning, everyone. Unprecedented, 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 unprecedented. This is, of course, an unprecedented situation in a situation that is unprecedented, 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 unprecedented numbers in an unprecedented crisis. Unprecedented, 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 unprecedented crisis.
Thank you.
Sometimes my microphone doesn't like to come off mute. Interesting, right? I always like I like to look at the talking points. I like to look at what they are pushing. Even the government's choice of words is notable a lot of the time, especially this government. They're very purposeful with their choice of words and what they say. And this unprecedented thing, how long does something stay unprecedented, right? Like, this is an unprecedented emergency for 2 months? Right? Is that why we're still sitting around with seemingly no real plan other than the plan the premiers have come up with to open up our economy? Is that why that's going on, or is it because who knows, right? Like, why? But it's unprecedented, this lack of leadership. Unprecedented. Okay, so I teased about the nurse. Here it is, Global News. Global News is reporting former Duval nurse says she faked symptoms to get tested for COVID-19 and it came back positive. Now, I'm not necessarily suggesting that we're in a goat and papaya situation, but I am suggesting maybe there's a flaw in these tests. Maybe there's a lot of false positives. Maybe that's skewing numbers. Who knows? The problem with this is there are a lot of people who put a lot of faith in numbers, right? The Chinese numbers are definitely true. And I mean, Patty Haydu, right? I'm sorry, you're spreading conspiracy theories by even asking about the quality of the Chinese numbers, right? How dare you even question Mr. Xi and China? They're doing their best, don't you know, right? Like, as the eyes go dead a little bit. So it's weird to me how many COVID things seem to be based on muddy numbers, muddy data. And when you get doctors like the two doctors from California who put out their numbers and said, like, listen, the death rate here is really low. It looks like this is a really widespread infection. Lots and lots of people have it, and most people aren't dying. This lockdown is way overblown. We shouldn't be doing this. Those videos get scrubbed from YouTube. So isn't that weird, right? Like, isn't that strange? And I bookmarked a little website, and it's called altcensored.com. And here's the doctors that I was talking about, the conclusions that they draw with their data, etc. They're on the front lines of this, right? I'm not trying to push misinformation. I'm trying to give people the truth. And what is the truth, right? The truth apparently these days is subjective. It matters who you believe, right? If you believe these censored guys, then the truth is very different than what our governments are acting on at this point in time, right? And that should be talked about, right? That shouldn't be forbidden. right? And it is. It's weird. So anyway, link is in the description for that website. There's lots of interesting videos on there, all sorts of things deleted by YouTube. Okay, back to the nurse. Sorry, I got on diatribing, but here we go. So I set it up, but here it is again.
Ended her duties. She chose to help in other ways.
And I was also sitting with the people who were passing away because I didn't want them to do that on their own.
But Kemp says the West Island Public Health Authorities insisted she continue as a nurse or not at all.
So I resigned from Heron.
Kemp accepted a new job at a senior's residence in Lachine. She had no symptoms but wanted to be tested before starting.
So I called. I told them that I'd been working at Heron. It was a COVID hot zone. I was around the sick. I was around people who were passing away. But I was asymptomatic. And they told me flat out, no, you don't need a test.
She called back and pretended to be ill.
And I made up symptoms. I said I have a fever. I have a cough.
Within 48 hours, she learned she tested positive.
I couldn't believe the fact that I had to fight and lie to get a test. And the possibility that I could have gone to my new job and brought it with me is absolutely terrifying.
The West Island Public Health Board refuses to comment on the specifics of her case. In a statement issued to Global News Sunday, spokesperson Guillaume Berube writes, employees must have symptoms to be tested, and the national screening strategy focuses on those at highest risk. A nurses' union spokesperson agrees with the current testing criteria, but also sympathizes with what Kemp had to endure.
I don't think that you should fake a symptom to ask to be tested. I think you should ask, and this should be available.
So she doesn't agree with the current testing standard. Like, either you agree with the current testing standard, which says you have to be displaying symptoms, or you disagree with it and think that it's somebody who requests being tested should be tested. Or you think that the standard should be changed to include people who are changing jobs from nursing homes who work with COVID-19 patients to other jobs that don't work directly with patients. And having somebody sit with dying people not tested before starting a new job, don't you think that's a big leaky hole in our whole contain the disease and flatten the curve and all that other stuff? The rhetoric doesn't match the action. What's going on, right? Like, if you have one case and one case is too many in the world and blah, 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 blah. And oh, by the way, open everything back up again too, right? Like Quebec's sending kids back to schools. We have conflicting actions and words, right? And either this thing is terrible and a big scourge, or it's not. If it's not, we need to get the economy running quickly, right? So, I mean, it seems really, really wild that we've got nurses who are saying, you know, I can't be a nurse anymore because X, Y, Z, whatever reasons. They're being told by their employer, no, you've got to be a nurse or nothing. And then they leave because you've got options as a nurse at this point in time. Pretty much anybody's asking for help so they can get another job somewhere else, right? And the emergency top up and all of the other things. So she did, but she can't work now because, this seems pretty asymptomatic to me. Maybe I'm wrong, but it seems pretty asymptomatic to me. So what, right? Like, and I don't think that she should go into work, but if COVID-19 does this to 30-year-olds, okay, right? Like, and who knows, right? I don't know what's true, but it seems like we're stalling, and that seems odd to me. Here's another part of the equation. It's not just the economy that's suffering because of the COVID-19 shutdown. There are other people suffering medically because of what's happened. And here's a National Post article published on May 9th, 2020. Sacrificed in the name of COVID patients, tens of thousands affected by surgery cancellations. Jim Mann recites the numbers without hesitation. He had 19 tests and 7 meetings during a marathon week of screening at a Toronto hospital in March. The reward at the end was nothing less than a new chance at life, a spot on the facility's lung transplantation list as emphysema cut his own lungs capacity by almost 75%. Now, I'm just going to quick aside here. A dual lung transplant sounds like an awful tough road to go. Wow, that's hard. Jeepers creepers. Okay, back to this. 3 days later, the University Health Network called to inform him that everything was on hold. Mann knew he still had to wait for a matching organ donor from a deceased donor, but Ontario's cancellation of elective surgeries to ready for a feared surge of COVID-19 patients means nothing could be done for him until the restrictions were lifted. It's very heartbreaking, to be honest, says Mann, a retired home renovation salesman from Niagara Falls. It's definitely worrisome. I'm only 65 years old. He's part of an overlooked fallout from the pandemic lockdown. The thousands of Canadians whose treatments have been delayed for close to 2 months already and could be postponed for weeks more. Almost 200,000 surgeries and other procedures, cancer screening tests, and clinical trials of experimental medicines were shelved indefinitely as hospitals braced for a possible flood of COVID-19 patients, a deluge that never quite materialized. Meanwhile, many hospitals have sat barely half full. Doctors and patient advocates say the dramatic overnight retooling of the national healthcare system luckily didn't trigger a tsunami of deaths or other bad outcomes for non-COVID patients, thanks largely to careful planning. But there is evidence of negative impacts nonetheless. Modeling in Ontario estimated the cancellation of elective heart surgeries would result in more than 30 deaths by early May. We're past early May now, by the way. College of Dr. Andrew Cron, Vancouver-based president of the Canadian Cardiovascular Society, called to check on a patient awaiting the pandemic-delayed implant of a defibrillator, a device designed to prevent lethal heart rhythm problems. His daughter answered, revealing that the patient had already died, said Cron. Delilah Oliveira, excuse me if I've got that wrong, a Surrey, BC woman, told media that her 50-year-old husband, Chris Walcroft, passed away April 15th, weeks after the procedure to prepare him for life-saving kidney dialysis was canceled. For other patients, there was at least the anxiety of having to wait longer to have a tumor removed, clogged artery cleared, or painful joint replaced. In Ontario, only about 20 to 40% of the usual volume of elective cancer surgeries has taken place during the lockdown, estimates Dr. Chris Booth, an oncologist and professor at Queen's University. That's been a massive problem for patients, he said. You can imagine how anxiety-provoking a cancer diagnosis is at the best of times, let alone during COVID-19. And then on top of that, they have the uncertainty about when they can have their surgery. Provinces like Ontario and BC announced this week they're resuming suspended operations, but now have to cope with the backlog. That could take as much as 2 years to clear in British Columbia, Health Minister Adrian Dix said this week. And the longer the delays, the worse possible outcomes, predicted the Ontario Financial Accountability Office in a report on the pandemic, echoing others' concerns. Sad comment, it will be more and more difficult to reassure our patients about the impact of this delay on their prognosis, wrote Dr. Diane Francois, excuse me if I've got that wrong, president of the Quebec Federation of Medical Specialists, in a newsletter Monday. This is the great stress, says Yves Vibala of the Quebec Cancer Coalition. If you have stage 3 cancer or stage 2 that is still operable, you could wait for 4 to 6 weeks, but if you finally get operated on 4 months later, maybe it's not operable anymore, maybe it's progressed to stage 4 cancer. Hospitals began to transform themselves in the middle of March as horror stories from Italy convinced authorities that they had to free up room on wards and in intensive care units for potential COVID-19 sufferers. Canceling non-emergency and non-urgent operations, the thinking went, would mean fewer patients recovering in ICU or being exposed to the infection. Since the changes began, Ontario had performed 72,400 fewer surgeries than the year before, while BC saw 30,000 canceled. A rough extrapolation based on the two provinces' share of the population points to 189,000 postponed operations nationwide. That's a lot of operations, right? I scroll down. Regular screening tests, mammograms, pap smears, colon cancer tests have been put on hold. Screening is by definition for asymptomatic people and designed to find cancers early, but it's unclear what the impact will be, said Meyer. Chemotherapy and radiation treatment have gone ahead in many provinces, though with pauses for some patients, says Maskins. There's little evidence as to what effect the change will have either, she said. Meanwhile, some patients waiting for surgery or other treatments are being prescribed oral take-home drugs such as tamoxifen that can fight the cancer, but typically would be started later in treatment. New trials of experimental drugs often last best hope for patients with metastatic cancers, though have also been halted, noted Vilaba. For heart patients, cardiac specialists are trying to keep in regular contact, so if symptoms like fainting suddenly appear, their delayed surgery can be moved ahead, said Cron. Meanwhile, earlier in the story, Cron lost a patient, right? Come on, back to this. Meanwhile, physicians are concerned about another side effect of the pandemic, reluctance on the part of some Canadians to seek help when they feel ill. The people who do come to hospital are sicker, said cardiologist Cron. That's because they started getting sick and they waited until they were desperate to come in. Indeed, the family members of Cardiovascular Society employee in Ottawa started feeling acutely unwell recently, put off seeking help, and 3 days later died in her sleep. She likely suffered a heart attack and then heart failure, said Cron. Ontario had reported 30% reduction, and BC a 40% drop in people presenting to emergency departments with STEMIs, the most serious type of heart attack, according to the Heart and Stroke Foundation of Canada. There also seems to be less demand for MRIs, CT scans, and other diagnostic tests that can detect cancer, again suggesting people are avoiding help, said Meyer. What are we missing, he asked. Are people tolerating things because of the hope they're just going to blow over? No, what happened was there was a coordinated media push that said, don't go to the hospital unless you're feeling sick. And if you're feeling sick, shelter at home. Don't bother us. We're dealing with COVID-19. Right? Don't you remember? So the other day I put this tweet out. It said, why are 5,000 meat packers tested positive, but not 5,000 nurses or doctors? And somebody sent me this. And so there was an 800 case rise in QP employee infections from April 27th to May 5th. And so that's a 43% jump from that week. But still 2,892 QP people in Ontario. And here is Global News reporting Quebec Healthcare Network missing 9,500 workers amid coronavirus. And the Francois Legault says that 4,000 were diagnosed with COVID-19. Now, I'm not sure if that's, I don't know where they're getting the 4,000 number from. I haven't seen, part of my issue is I haven't seen the numbers reported this way. I haven't seen anything talking about the number of cases in healthcare. I haven't seen the number of people in ICU from this subcategory, right? This QP press release says that they have a 4-time higher likelihood for infection. But through the news is talking about meat plants, right? The news is talking about meat plants being affected. Here's one from April 23rd. 2 Alberta meat plants affected by COVID-19 make up to 70% of Canada's beef processing capabilities, right? So there's one, and they're talking about, I think it was 63 workers in this case. I think it's only 63 in this one. The next one, here's this. This one's from May 10th, and this is talking about 171 of 500 workers in one cargo plant, and then another one, 900 of 2,000 workers. So, like, my question is, what's the difference? And people were saying beef workers live in closer proximity to each other. They don't wear masks in their plant and stuff. And I think meat places, meat packing, and like we have a meat packing plant and a meat processing plant in Guelph. And I've had family that works there and friends that have worked there. And like, it's kind of a rite of passage. And they have like hairnets and they wear all sorts of stuff around the beef. And not to say that it's a bad environment or anything like that, but and not to say it's comparable to hospitals necessarily. Like if you get an infection, right? But where's the cases of Walmarts that have had an outbreak, right? That are terrible. Where's the cases of the other essential workers that have had outbreaks in other plants? Where's the grain workers that are being infected, right? Like it's strange to me how many in this environment, but no other environments, right? And I mean, do these count? Like this level of infection, I don't know how it compares to the meat, the meat workers' infections. And then once we've got those numbers, I don't know how. Oh my goodness, I'm really long. I don't know how those. Sorry, I'm just talking today. I don't know how those infections play out. Do those people end up in hospital, and how many in ICUs, or is it just a whole bunch of people are not sick and like 2 or 3 end up in hospital, or even less, or what? Like I don't know how it's playing out, and it's hard to discern because the articles aren't really clear. Like it doesn't update you on, the last one was quick, right? Like the last shutdown was 2 weeks according to this article, but it doesn't tell you, percentages of workers who have returned, percentages of workers who have recovered or anything like that. It's all just pushed into the same provincial data sets, right? And they're pushed from the local sets. The local sets feed the provincial set. I don't know. And I'm not trying necessarily I'm trying to start a conversation, right? Why? What is this? What is the situation that's causing this? Because if we can solve that, then potentially we have a road to normalcy that will be acceptable to the powers that be, right? But instead, we've got people who are being forced to start new jobs without getting tested, right? No, you don't need a test. Go to the new job, you new nurse, you. Like, it seems crazy, right? It seems wild. And the press not really bothering to talk about the healthcare workers necessarily, more focused on the meat. And I mean, unless they're writing a puff piece about the hero healthcare workers, which seems like propaganda. I think I'd be uncomfortable if I was the subject of this fawning by the press. But that's just me. Okay, I'm too long today. Sorry about this, everyone. Thanks for watching. Check out CanadaPoly.com. Check out CanadaReport.co. Check out Speaking Moistly. We're going to get back with Greg tomorrow. I haven't talked to Frank. He sent me a message saying that he got everything set up, and we were going to try and get together on Sunday, but then I got busy, and he got busy, and I think we're going to do it again on Thursday. So, again, thanks for watching, everybody. Have a wonderful, wonderful day.